Hi, and welcome back to my channel. I attempted to post a video yesterday, and I had a new video editing program, and somehow the audio and visual did not sync. So I'm going to try again, and hopefully this will be better than the first one that I attempted. So today is day 10 of sheltering in place, and we're going to revisit the topic of vitamin D therapy. And my subtitle for this is The Therapeutic Value of Vitamin D Supported by Controlled Scientific Studies. So I am excited about this topic because I'm going to put a little feather in my hat. The initial video that I produced about the role of vitamin D and seasonal influenza turns out, well, first of all, that I didn't discover that causal relationship. But that's okay, because I had come up with the relationship on my own without any previous knowledge about this correlation between vitamin D and infectious disease. And my theory was this, that seasonal influenza is not caused by a colder temperature like in the winter months when it's more prevalent, but it is actually caused by a lack of vitamin D because of the number of daylight hours that the sun is out, the weather preventing us from going outside in the winter months, and also the angle of the sun in the winter months does not give us that vitamin D ability in our skin to change sunlight to vitamin D in our bodies. So since then I've watched several videos about the therapeutic value of vitamin D in both respiratory and many other diseases. And these studies actually support my theory. So that's what's exciting for me. And I will put a link below to the other scientific studies that support my theory. I'll actually link one that's in for layman in ordinary English, and I'll link a couple of other more scientific videos for either the medical professions or anyone who understands the physiology of the human endocrine and respiratory systems related to various diseases and conditions that are included. Now, I'm going to list a bunch of the findings of these studies, and excuse me, the first one is a study presented to an ENT conference, ear, nose, and throat. And these studies found the deficiency of vitamin D is associated with periodontal disease, allergic rhinitis, chronic rhinosinusitis with nasal polyps, otitis media, that's earaches, acute respiratory infections, and that's the one we're most interested in right now, adenotonsillar hypertrophy, and obstructive sleep apnea, and head and neck cancers, recurrent. Well, in addition, other studies showed other extraskeletal diseases that are associated with vitamin D deficiency. And those include, I'm going to read this list, muscle pain, weakness, fatigue, and what is often misdiagnosed as fibromyalgia, and cancers that include bladder, breast, colon, esophagus, gastric, lung, cervical, endometrial, ovarian, rectal, renal, vulvar, Hodgkin's and non-Hodgkin's lymphoma, and melanoma. And autoimmune diseases such as MS, multiple multiple sclerosis, IDDM, don't know what that is, RA, rheumatoid arthritis, and Crohn's disease. In addition, it found neurologic and psychiatric diseases are affected by vitamin D deficiencies, including dementia, depression, schizophrenia. The whole field of infertility is affected by vitamin D, cardiovascular diseases, and infectious diseases, of course, and that includes tuberculosis, influenza, and even viral URIs. And dermatologic diseases, including eczema, atopic dermatitis, and more specific respiratory diseases such as COPD, allergic rhinitis, asthma, influenza, and CRS. And what I don't see on this list, I don't think, is pneumonia, common cold, SARS, ARDS, and there's probably more that could be added to the list too. Excuse me. I have postnasal drip, and that might be related to, I haven't figured out what, maybe asthma, or perhaps it's just an allergic reaction. Don't know. Anyway, on to the topics here of importance. These studies found that there are groups of patients that are at risk, higher risk for vitamin D deficiency. And I'm going to again read this list. And these are based some on physical factors, environmental factors, location, where you live. So let me show this list, or tell you this list. African Americans, and it's found that they need 4 to 6 times more sun-induced vitamin D because of their skin color and the way the skin absorbs the sun and turns it into vitamin D. Obesity, those with basal metabolic indexes of greater than 30, and I'm in that list. I'm minus 32, I just found out, and I am going to go on a diet now that I'm self-imposed isolation and not going out to buy my ice cream and donuts and other things that I love. And also elderly. They found that the skin of elderly people doesn't allow that sunshine turning into vitamin D as well as younger people. So, and I know my skin's getting kind of paper thin, looks like tissue paper. You can, see through the skin actually. So elderly, and people that have a difficulty with fat malabsorption in such diseases as cystic fibrosis. People who don't get out into the sun, they're homebound, or they just don't have exposure to the sun. Could be climate related, could be location you live. And people who live in the northern latitudes. People who have recurrent respiratory tract infections. And people with chronic sinusitis, and they mention again here polyps, nasal polyps. Well, after reviewing many studies, the conclusions that I come to is that the range of vitamin D that's recommended for adults is between 4,000 international units up to 10,000 international units per day. And it's been shown that with full body exposure to the sun with a bathing suit on for 15 minutes without sunscreen is equivalent to 20,000 international units of vitamin D. So chances are we can go up to 20,000 at least and benefit from even more than 4,000 to 10,000. But if you supplemented the time out in the sun with additional vitamin D capsules between 4,000 and 10,000 per day, then that would be beneficial. if you just are outside with your legs and arms exposed only, in the sun, full sunlight, for 15 minutes, that would be the equivalent of 3,000 international units of vitamin D. And of course, this is without sunscreen, because sunscreen would just negate all the benefits of being out in the sun. Don't get sunburned. Stick to the 15 minutes or until your skin just barely turns pink. So, between 3,000 and 10,000 or 4,000 and 10,000 supplement vitamin D is recommended. And as I mentioned, it is probably even safer to go up to 20,000. The studies found that they could not really determine an upper limit of toxicity of vitamin D. So people who live in Florida, Hawaii, California, even here in Arizona that get a lot of sun, you probably get 100,000 units in a day that you're outside and eating well and maybe taking supplements. If you're out in the sun that much, you probably don't need the supplements. Now, vitamin D is found in some foods, but not too many. And because there's, years ago they determined that rickets is caused from lack of vitamin D. And that's when they started giving kids cod liver oil. And because that on our list is a higher amount of vitamin D. And of course, rickets is not common today because we know how to treat and prevent rickets. So cod liver oil, egg yolks. An egg yolk has 20 international units of vitamin D. Mackerel, salmon, canned, has 300 to 600. And fresh salmon has 100 to 250. Sardines, 300 in 3.5 ounces. Shiitake mushrooms that are fresh, 100 IU, and shiitake mushrooms that are sun-dried, 1,600. So sun drying, in fact, I didn't find this, but it's possible that if you sun-dried fruits, they may absorb the sun and be beneficial. Now, that's not been proven. That's just my own thought here. As I outlined in my previous video, those living above the 37th parallel do not get vitamin D during the winter months. And that includes New York City, St. Louis, Denver, San Francisco, and all points above the 37th parallel. And here's a map that shows that parallel line above which in the winter gets the angle of the sun and the number of daylight hours prevents you from getting your vitamin D. So doesn't it make sense? People living in the northern latitudes and during the winter months, that flu would be more prolific than in the summer months. That makes sense to me. And so it's not all about temperature. It's about the immune system being bolstered by natural sunlight in the summer to make our own vitamin D. So I'm really excited about supporting my theory that I presented in my previous video. And there's that again. I'm going to link below my previous video in case anyone would like to see that again. It presents this, but in more of a hypothetical than in supported documentation from scientific studies. So I want to thank you for watching, and I'm really excited that I can share this easy and possibly strategic, efficient method of strengthening your body's ability to fight off viral infections like COVID-19. And please follow the guidelines presented by your local and national health experts and your governmental, the president and FEMA representative and the World Health Organization guidelines and the CDC and everybody who is inundating us right now with information about how to protect ourselves. And of course, I'm going to repeat this includes personal hygiene, washing your hands frequently, social distancing, staying inside, not even going out into the environment where you might be exposed to the virus. And that's especially true for elderly people, those with compromised immune systems, those people who have underlying complications and conditions that would make them more susceptible to developing pneumonia, because as we know, this COVID-19 was first described as being an unusual, strange, and extremely virulent pneumonia. So pneumonia is the complication that kills people. And that's why we want to lower that, to flatten that curve. And we can do that by following these guidelines. And self-quarantine, voluntary isolation, and soon we may have enforced quarantine. I see that coming for every state in our country. And as you know, as of yesterday, the United States surpassed Italy and then China as the number one country in the world with the most tested cases of COVID-19. And we're approaching, I think, 90,000 cases. Our death rate isn't as high as some of the other countries, and hopefully it's because we have good medical facilities. Our health systems are gearing up for the peak that's coming in all states. Many states have issued lockdowns, and of course schools are closed, religious facilities are closed, sporting events, entertainment events, and you name it. The only thing that's open are grocery stores, drug stores, and the infrastructure personnel required to keep our societies going during this time. So, as my late brother-in-law always said, if you have a choice, don't be dumb. I send my love to all of you. I am Natasha.